When I go to see my psychotherapist, I have to pay a copay like anybody when you have to go see a doctor or a cardiologist or anything else. My copay is $10. That $10 is equivalent to the copay that I pay when I see my primary care physician. I did wonder at one point why I was paying, the same and not more to see a specialist. And what I uncovered was something called Timothy's Law. Timothy was a 12-year-old boy who committed suicide by hanging himself. He was diagnosed with numerous mental illnesses and had exhausted his parents' healthcare plan for the mental health benefits, and they were forced to um, no longer have custody over him so that the Medicare system would kick in and take care of his ailments. But even after Timothy got better, when he came back home, he was subject again to the same laws and the same principles that healthcare companies had put out, which basically are limits on the amount of care you can get for mental health versus how much you can get for a physical ailment. Timothy ended up killing himself. So right now, basically, when I go to see my doctor, my copays are pretty much the same. I'm either going to pay the copay that I would pay to see my primary care doctor or to see any other specialist. You see, prior to 2006, healthcare companies were able to save a lot of money by not covering mental illnesses. And it's funny because about 57 million Americans are diagnosable, according to estimates that I've read, with a mental illness each year. So basically, this law, Timothy's Law, came into effect and became permanent. And what it does is it creates some equality between those facing physical ailments such as cancer or high blood pressure and those facing depression or bipolar. It still does not cover every single mental health illness, and it still needs help, but it is part of creating equality for people with mental illness like myself.